Welcome to our It's Okay to Not Be Okay mental health forum here. And we're talking about mental health. This is also being sponsored, by the way, by the Detroit-Wayne Mental Health Authority. I'm Dr. Frank McGeorge, WDIV's resident doctor and medical reporter. This is being streamed live on Click on Detroit and Facebook Live as well. If you have questions, please submit them through Facebook Live and we will be able to get to them later. But first I want to have a discussion with our guests here. And I want to start with some introductions. I'll start with myself first. I'm Dr. Frank McGeorge. I'm an emergency physician here in Detroit, and I see a lot of mental health problems in the emergency department. And I think that's why I'm well suited to sort of, I think, bring this panel together and bring some of my own perspectives on the mental health challenges. To my immediate left here is award-winning actress Glenn Close. Most of you, I think, will recognize her. She is also the co-founder of a very important nonprofit, Bring Change to Mind, and it's really helping bring awareness to mental health issues. Over to her left is Senator Debbie Stabenow. She is a longtime advocate for mental health services, including bipartisan legislation, specifically the Excellence in Mental Health Act, which has really brought a lot of funding and resources to the table to combat mental health issues. Now, to my right is Sam Lippert. Sam is a sophomore at Washtenaw Community College, and he is really here and able to speak specifically to mental health issues and especially depression in the young community, among our youth. And I think that's a really important thing because mental health issues oftentimes present in the youth of our community. And then to his right is Lori Doyle. Lori is a peer support coordinator with Macomb County Community Health, and she herself has faced issues of depression, but recovered with the help of community resources that she is now a part of and can speak to some of the community resources that are available and that really, I think, will help people on very practical levels. And I think that's something that we really want to kind of focus on. I'm going to really start by, I guess, opening it up with a little bit of my perspective. My perspective as an emergency physician is once patients reach us in the emergency department, things have often gone off the edge. They have gone too far. They are now very obvious. When people reach us with depression, suicidality, bipolar disorder, and all of the manifestations and life changes that can occur there, whatever the mental health issue becomes, once they see me, it's a little bit too late. We have challenges in the emergency department with obtaining resources and obtaining placement for those individuals. But really, I think what's much more important is getting help and getting people to the resources that they need long before they end up in the emergency department. And that's, I think, where Glenn Close and her organization really come into play. And so I'd like to start with Glenn. What brought you specifically to become such an aggressive champion for mental health awareness?
It was actually my sister, Jessie, who came to me one day out of the blue. We'd been visiting my parents, and she said, I need your help. I can't stop thinking about killing myself. And her son, wonderful Kaylin, had already been in a psychiatric hospital and was diagnosed with schizoaffective disorder. Sure. But even that was, for me, I didn't quite understand what he was going through, even though I visited him when he was there. But when my sister Jessie came to me in person and asked and said that, it hit me. It was a profound wake-up call. And my mother and I were able to help her get help, but I realized that we had no vocabulary in my family for mental illness. We never talked about it. My father was a doctor. We just never talked about it. And that almost cost Jessie her life. And so Kaylin and Jessie asked me to do something to help fight the stigma because they found that the stigma could be just as bad and horrible to live with as the illness themselves.
So I'm hearing two things. On the one hand, there was essentially a lack of awareness, languaging in terms of asking for help. But did they had some self-awareness then that there was a problem, but they weren't comfortable coming forward?
I don't think they knew what the problem was. I mean, certainly my daughter didn't know what was happening when she observed her son having what was a psychotic break.
Right.
And it actually was a friend of hers who had studied psychology in college, who spent some time with Caitlin alone, and said to Jesse afterwards, I think he has schizophrenia. And that for Jesse was like a shock.
Yeah.
But when Caitlin came back from the hospital, all his friends left him. Not one friend came back. And he had been the leader of the gang. And he's now in his mid-30s, and one friend has come back. And Jessie was afraid to, when she was diagnosed finally with bipolar disorder, she was afraid to tell the friends of her little girl that she was battling with a mental illness, because she thought that they wouldn't allow their children to come and play.
Right.
So it really has an insidious, toxic effect on everyday life, and you simply just have to start talking about it. And so I love talking about it.
Well, that's great.
We found that there was a lot of depression, suicide in our family, never talked about. So that's the main goal, the main mission of Bring Change to Mind. Start the conversation, and just by starting the conversation and making people feel that they're not alone, they don't have to be full of shame, they don't have to be fearful, that will literally save lives.
Exactly. Well,
and I have to say, in having met Kalen, he is an incredible young man, extremely impressive, and having met Jesse as well, and having Glenn come into DC, and Jesse, and Kalen, and advocate for services. All three of them are incredibly effective. And as you were talking about Kalen, I was just smiling because he's an incredible young man, and your sister is doing great as well. So it's wonderful to see.
Well, and Senator Stabenow, you bring up a very interesting segue here, because, of course, awareness is only one part of everything.
Right.
Funding and really bringing the necessary programs to the fore are very important. Of course, medical care in America is a very controversial and expensive topic, and funding for mental health especially is a very complicated issue. And so, you have successfully brought legislation, bipartisan legislation, to the fore to really help with mental health awareness and with treatment. So I guess, can you talk about what you see in terms of the funding challenges, and more importantly also some of the innovations in treatment that you've seen implemented across the country?
Well, first let me say, I think it's more expensive not to treat mental illness and addiction than it is to treat it. And that when we say comprehensive health care, we should mean health care above the neck as well as health care below the neck. And so, and 1 out of 5 people in our country will have some kind of a mental illness or condition in their lifetime. 1 out of 5. So this is much more mainstream than we are willing to acknowledge, which is why what Glenn's doing is so important in terms of talking about it and bringing awareness. In answering your question, I too want to start though by saying this is something that I know about personally. I grew up with a dad who was misdiagnosed multiple times and finally diagnosed correctly as being what we now call bipolar. He was at the time manic depressive. And I saw what happened when he didn't get services. And my mom's a nurse. She was director of nursing at a small hospital where I grew up in Clare. So I was around medical community all the time who misdiagnosed him. At that time, I was young. This was like in the 60s, everybody was schizophrenic. That was it. I mean, it was nothing else. And
broad.
Just broad. And so when he finally got diagnosed, he finally got put on medication, lithium, that helped him. He was never went back in the hospital again, and was able to go on and live his life managing a chronic disease. So this is no different than somebody who's diabetic, has to check their sugar, has to take insulin, and has to manage a chronic disease. That's what this is, and we need to think of it like that. So for me, growing up and having been involved in these issues, policy issues, as an adult and now in the U.S. Senate, there's several things I've been involved with. One, when we passed the Affordable Care Act, I authored the provision of what we call mental health parity. So the insurance has to cover mental health and addiction the same way we do physical health, not higher copays, not limits on service and so on. And now this is unfortunately being undermined with changes, but this is important. But we don't have mental health parity in the community, and that's what the Excellence in Mental Health Act is about. We've now expanded to a second version of Excellence in Mental Health and Addiction services to broaden that out. But the whole idea is to have comprehensive services. We have now passed a law to define what a qualified behavioral health clinic looks like in terms of the quality standards, including things like a 24-hour psychiatric emergency facility, so folks aren't going to the jail or aren't being, or the ER.
The emergency room.
Yeah,
yes,
exactly. And so the goal is to have those facilities in every community. Not there yet, but we now have the expectation, because we've been able to pass that. We have been able to fund comprehensive services in 8 states. Michigan's not yet one of those, although we have another round coming. We're going to find out in September. We have 14 community mental health agencies that have applied for funds, so hopefully we're going to see an infusion coming in to Michigan as well. But the idea is to be able to basically provide funding for a psychiatrist, a psychologist, a social worker, the same way we fund a doctor, a nurse, and so on. Right now, you go into a health center, you go into the hospital, you are reimbursed for your service, you as a doctor.
Right.
If you are working in a mental health agency, you are not fully reimbursed. There's a small Medicaid reimbursement, and then it's grants. And then what happens? The grants run out over and over again. And so I say all the time to folks, can you imagine if you needed heart surgery and the doctor would tell you that, gosh, you need heart surgery, but I'm so sorry the grant ran out. We would never say that. We say that to people with mental illness every day.
Well, right, and I see it in the emergency department when we're trying to place people that are in acute crisis.
Yes.
And we have sometimes multiple day waits
Yes.
in the emergency department for people to get placement.
Exactly.
But really, the better answer would be to avoid those crises by getting longer-term outpatient care.
Yes, outpatient care, and frankly, it's a continuum. It's stopping the stigma, so someone themselves reaches out for help, or their roommate, or their family member, or their friend. It's also about we're funding efforts to make teachers more aware in school. It's called Mental Health First Aid. The problem is we can be more aware, but if there aren't any services, then what do you do after you have identified a child that needs help?
Right.
So then that goes to the services, which is the most important piece, having in the community comprehensive services, working with families, working with the individual, whatever their age, helping them get medication if that's what they need, helping them get therapies, helping them understand, and maybe diet and nutrition, the whole range of things that can help. And putting that in place, I mean, when you think we have 1 out of 5 people that will have a mental illness sometime during their life in the United States. We don't treat it comprehensively as a part of the healthcare system. That's the issue that I'm very focused on.
Well, and you say 1 in 5. What I find interesting is that unless you're somebody that has a family member or friend that has dealt with a mental health crisis, you're really, in some ways, unaware, oblivious, and really I hate to say unsympathetic in many ways to the needs that are out there. And I don't think that people that aren't touched by it fully comprehend the way it, frankly, destroys not just single lives, but families.
Yes.
And it's a societal issue. It affects all of us in many, many ways. And I think that's really kind of an important point that gets missed oftentimes.
Absolutely.
People think it's someone else's problem if they're not affected.
Well, and it's interesting, as I've reached out and worked across the aisle with colleagues for several years, I can tell, whether they say it or not, if someone has someone in their family that has a mental illness, because they are the most willing to step up and most aware. And then the challenge is really talking about it. And so I've spoken on the Senate floor, I've spoken at conferences. I'm very open about what happened. This is a disease of the brain.
Yeah, right.
And it's no different than any other kind of a disease, except because it affects behavior, we look at it differently. We don't understand it as much. But it's a disease like any other disease, and we need to be talking about it, supporting people, making sure they get the help they need.
And the 1 in 5 is also the Congress.
Right. Yeah, that's right.
No comment.
That's right.
And with that, I will actually
that's right.
turn to Sam, because Sam has a very important awareness point. And and actually, I guess I just want to start with the shirt that you're wearing here, Sam, because I think that's an important element to your background as a college student and somebody that has seen the effects of unawareness and lack of attention to mental health, especially in the youth of our society. So please talk about what's on your shirt to begin with.
So the shirt is for one of my friends and teammates who killed himself Memorial Day weekend of 2017. His name was Miles Jeffrey Roberts, and he was 15 years old. He, I found out after the fact, had been seeking counseling with regards to his depression, and I thought, as he was a freshman that school year, I was a senior, I thought my senior class, with the football team, the football program, and the hockey program that we were both members of, and the coaching staffs had both, I thought we had made it very adamant that, anyone can reach out to us at any time. I will, and I say this, I'm a football coach now at Skyline. I say this to my athletes. I said it as a senior. If you call me 2, 3, 4 in the morning, I will pick up my phone. I will come get you. I will meet you wherever you are, and we can talk. We can go for a drive in silence. I will sit there with you. We don't have to say a word, but I will come and I will meet you, and I will try to, make sure we can help you through whatever issues you're facing. And I thought I had made sure, that was a prominent point. And then Memorial Day weekend, I am with my girlfriend. We're watching TV. My mom comes with tears in her eyes to talk to me. And she says, Miles is in the ICU of the hospital. He jumped off a bridge. He might not live through the night. I didn't even think he was jumping off of a bridge to kill himself. My first thought was, oh, Miles, I was angry because I thought he had been jumping in the Huron River off of the train tracks. Or I thought he'd been doing something like that because that's real popular. I live stone's throw away from the Huron River. A lot of people like to go jumping from the bridge. And so I thought he had been doing something like that. And so my initial reaction was anger. And then it took sitting down and listening to Miles's older brother's Zach talk and say, no, this was a suicide. He had attempted it earlier that night, and he had completed it about, I think he said 4 or 5 in the morning, and he was found and taken to the hospital. And it took that realization and that just the moment of seeing one of my dearest friends in tears that his younger brother had killed himself, for me to finally realize this was not an accident. This was a successful attempt on his life, and he had done it on purpose.
Well, Sam, do you see that as a lack of awareness on the part of people around him, or how do you think this could have been avoided?
I see it as the narrative around mental health is, and I'm speaking right now as a young man, that a man showing signs of depression or talking to someone about mental health is perceived as weak. And that's I'm a JV football coach. I played ice hockey growing up. I have seen lots of, the scenario of man up, don't cry, some explicitives added to those phrases. And we expect young men to be tough and to bottle up emotions and show nothing but anger. And then when it finally releases, we get a scenario like Miles. If you had met Miles, you would have never guessed he was battling depression. He was suicidal. He always had the biggest smile on his face. He was the happiest guy in the room. He walked into the room and everyone's mood changed. He was happy. He made people happy. He was a funny kid. He was fun to be around. He was an overall good kid. And you never would have even suspected the slightest sign of depression with him.
So to be clear, depression, mental health issues in teens in particular spans both genders.
Mm-hmm.
And
most definitely.
It's not just young boys.
It's not just men.
But there's a stigma. Definitely, and there's definitely, I think, a stigma involved. Then is really what you're saying. What have you tried to get out as far as the word in the community to try and break that stigma? I mean, what's your message to anybody in the community that is young and might be thinking about, their own mental health, not just depression, but just maybe something about their life isn't going the way they would expect it to?
Well, my message is, the title of this broadcast, It's Okay Not to Be Okay. And that you can talk to anyone. You can talk to, now say your family members aren't as adamant about it, there are people in the school districts, if you are a student, whether you are a college or high school or even middle school student, there are social workers in the building for that. There are teachers who will listen. There are coaches. I was approached by Andrew Sorgatz, the head coach at Skyline. I had played for him for 3 years. The spring of my senior year, he approached me and asked if I would like to coach the following fall. And this was 2-ish weeks before Miles killed himself. And I said, I would love to, but I don't know how that will work with my schedule. Let me get back to you. After Miles did what he did, I made it a point to change my schedule to that, because if I can save one kid, that's one less family that has to grieve. That is one less, mentor to the person who, who kills himself. That is one less person wondering, what could I have done? What did I do wrong?
Yeah.
And so that's why, as a coach, I talk to the entire program monthly at minimum, saying, talk to us, talk to each other, talk to me. I give them all my phone number, my email address. If they send me a friend request on Facebook, I accept it, because I want them to be able to get a hold of me in their time of need.
And this is a great way to get that message out in an even bigger forum.
Oh yeah, yeah,
absolutely.
That's the that's the point. And so what I'd also like to talk about is days after Miles had killed himself, I emailed Senator Stabenow's office, and I thought it was a shot in the dark because it wasn't my Gmail to Senator Stabenow's personal email. It was a form where I did my email address and my phone number, and I typed my message, and so I wasn't even sure if Senator Stabenow was ever going to see it. And so then for last week for me to get a phone call, it's just surreal to me. I got the phone call the day before my birthday. It's the best birthday present. This here is the best birthday present I could ask for. Being able to help those and help make a difference. I thought it was a shot in the dark. And then to get that phone call, and we can ask Matt, I was in tears by the time I was off the phone with him. I was in tears.
Yeah.
And then from there to call the hockey coach, who has helped make progress with this. We have a memorial game for him. I was on my way to work when I got the phone call. I am in tears. I'm sitting in my car crying. I'm making phone calls to the hockey coach, the football coach, the athletic director, and it was, I mean, it still is right now. It's just surreal.
It moved
the whole thing.
Well, and that's wonderful that it moved you to act and to do something and to really motivate your behaviors. And to that, to that end, Lori, you were also moved to change the entire direction of your life based on your interactions with the mental health community and your own personal struggles. I guess, you are somebody that is in a position to see the challenges for families and the difficulties with access. Can you talk about some of the difficulties that you see with access and the difficulties with identifying problems in the community by family members, let's just say, and when someone is in crisis?
Well, I know from my experience, I want to isolate when things aren't going good. And so sometimes you kind of got to push the person into getting treatment. And another thing that's really important is community mental health. We really need that funding. When I was going through I lost my son 7 years ago, and I just spiraled way down, and I went through a horrible time. I wasn't working. I had no insurance, and community mental health they saw to it that I was able to see somebody, and they really, it led to me being able to live my life again. And because it was a rough time, and for 3 years I didn't work.
And that motivated you to actually become
and then
part of the...
Right, I became a peer support specialist, which that is somebody who has suffered from mental illness themselves and worked their way through into recovery, and now works with people that are struggling with mental illness. And we're there to give them hope and let them know that you can move on in your life. Your life can be good. You have to put in the effort, of course, follow through with your treatment, whatever that may be, and it pays great rewards.
Yeah.
And it's so rewarding to do the peer support work. You should see some of the consumers, their eyes just light up when they see that you've been there. They didn't realize they would see somebody who knows what it's truly like to live with it.
And I guess really to that point, with Glenn and your efforts and what you saw with your own family, did it seem as though your family had reached a sort of, I guess, normalization where you thought aberrant behaviors and difficulties were just maybe part of life and didn't even realize that things had gone farther off the rails than...
Particularly with my sister, who was always considered, now I think with early intervention, she would have a totally different life, because I remember her when she was little. She had this thing where she would go like this, and it would become raw and blistered, and right now that would be a red flag right now, so. And she was just, oh, that's Jessie. She's the wild one. Oh, that's Jessie. She's, irresponsible.
Making excuses.
Yeah. My dad would say, pull up your socks, get an education. And she couldn't. She was incapable. But I just want to go back to the peer-to-peer, because one thing that Bring Change to Mind is doing is establishing in high schools science-based peer-to-peer clubs where kids go to a stigma-free place and they can talk to each other about what they're dealing with. And it's been incredibly successful in California, and now it's going to come to Michigan. We're talking about partnering. So I think the peer-to-peer and what you did, within your school, is so important, because kids, if they're aware, if they're made aware, they know each other. They know where they talk to each other.
Right.
And they know when somebody's in trouble, and if they know their places where they can go to, it's tremendously important. So I'm very excited. You can go on our website and learn all about it. And also, I think that's one really positive thing, is how social media, Twitter, Facebook, can be the community which is on bringchangetomind.org. It's a growing, vital community where even if you're at the first stage, I don't want to see anybody, but I can tell you that I'm going through a hard time. That's kind of the first step. But I really commend you for working within, your school. And
well, to sort of play off of that, about halfway through my senior year, maybe 3/4 of the way, we had an assembly from. It was the same idea of peer-to-peer. Other people do experience this. I forget the program's name, but they were out of a combination of graduates from U of M and MSU, and they were athletes specifically, and they had come to us and they had said, this is normal, especially as an athlete and as a student, and having to balance life as a student athlete is balancing the ratio of student to athlete. And they had talked about the stresses, and they had talked about that it happens, but they had never really provided what to do. Right. And they said you could contact them. And so I had emailed their group. And one of the things that really bothered me is I've not heard anything back.
Well, and
I haven't heard anything back from them, and they were supposed to be starting a club like your Bring Change to Mind at Skyline.
Well, we've had comments. Yeah, we've had comments on Facebook actually, specifically on the need for counselors and more services and funding, social workers in schools being stretched thin, and really having difficulty attending to all of the needs that do come up. And so, I think that's a real challenge, is getting the resources to the people that need them, but also really, as you're pointing out, a lack of awareness and bringing that awareness to the fore. Because without awareness, even if we have the resources, people won't seek it. Without the resources, the awareness isn't going to do anything either.
Wait, and if I can stress back, it really both is so important, but if we have the awareness and the services out there, then we still have a serious problem, and we have people that are frustrated and may give up and so on. And so both pieces of this are so important, both being able to talk, support each other, and then if there is an issue, being able to reach out and talk to someone. And we are woefully lacking on resources, on services. We aren't nearly where we need to be, which is why that's such an important piece of this.
Well, and to that point, Christy on Facebook is asking Senator Stabenow how there can be more funding for Medicare, Medicaid services that relate to mental health.
Well, thank you for the question. And I would say this, we are working on two fronts right now, even though I've said that grants are not where we want to go until we can get the full funding and reimbursements. We are increasing grant money. There's a community mental health block grant that we've increased. We've added also $500 million more to the VA for veterans, which is another important group of folks that we need to be making it okay to ask for mental health help. And so we have been increasing. We've added another $1 billion this year for opioid treatment, which is another piece of this. We talk about diseases in the brain, doctors, it's mental illness. It's also addiction changes your brain. And so these are illnesses in the brain that we need to be addressing. But in the long run, and it's hopefully not too long, we're in the middle of this now, we have to decide that we are going to fully fund behavioral health services, mental health and addiction, like we do physical health. So when you go in the emergency room, you are able to get care, but we want you to be able to go to a community mental health facility, to a 24-hour emergency facility that focuses on mental health and addiction, and for it to be fully funded with the professionals there and the access to treatment and medications. And so we're beginning that process right now. I mean, we have 8 states that we have now fully funded to do that, and now we're working to expand that out. And in the long run, I truly believe what we're going to show through the demonstration of the 8 states is that in the end, it's not more dollars, because you are more effective when you're actually helping people to lead successful lives. And just to ask the sheriffs, I know the sheriff wasn't, Sheriff Napoleon wasn't able to be with us today, but I know he would say that from a jail standpoint or a prison standpoint, but certainly in our jails, that we're housing a lot of folks. If they're not ending up in the ER, they're in the jail when what they need is mental health help.
Well, and within healthcare, we talk about the importance of prevention. And within the mental health sphere, prevention and really maintenance is so important on a constant basis. I mean, you have to really have a place to go where you can go when you're feeling a crisis coming on, when you're feeling your behavior change, because mental health issues frequently wax and wane much more than medical issues do. I mean, you know, you may have some changes in your diabetes, your heart disease, whatever, but mental health issues change much more frequently and cycle much more aggressively. And so if you don't have access, you can really face some more challenges. And actually there's a question on Facebook from Sherry to Glenn about how we can help to omit barriers when you discover that someone has a mental health issue.
Omit barriers.
Omit, or I guess minimize barriers when you discover that someone has a mental health issue. I think she's getting to the idea that if you, maybe by barrier, she might mean the stigma behind it.
Yeah, the stigma. Well, I think first of all, if you think somebody is suffering from some sort of mental health disorder, you have to be willing to talk to them and talk about it yourself.
Right.
And I think you need to educate yourself about what that might be. And you need to not let it go until you have closure on it.
Right.
Because a lot of people will say they're fine. When if your
almost everyone.
Yeah, if your instincts say that they're not fine, listen to your instincts.
Yeah.
And I think how we get barriers, stigma is probably the most relevant issue around mental health. It keeps people from getting help.
Yeah.
And if more people were open to it, if more people talked about it, there will be more people getting help and more people who could become advocates.
Right.
I think, you know, you go through it, you become an advocate. So it's going to be, you know, we just have to keep at it. So it's wonderful that she wrote in and asked about this, because it's really the basis of what needs to change.
Yeah.
You know, if she's asking the question, if you have somebody, or even yourself, if you feel that you need help, you find help. You know, find help. Go to someone. Go to a trusted friend, or go to a family member that you can trust.
Well, you know, one of the hallmarks of many mental illnesses is that, in fact, there is a lack of self-awareness. You don't know that things have gone off the rail yourself, because either you're making excuses or you're just unable to see it because you are in it. And I guess from the outside, people need to be aware and have the language and be able to say things seem to be deviating from a place that seems right. And
change in behavior that's not just you didn't get a good grade on a test, so you're depressed for a couple of days. You know, if you feel yourself that you're changing, or you see a friend who's changing their behavior in a significant way.
Don't be afraid to talk to them about it, and don't be afraid to engage them in some honest, open dialogue. But I think people need to be more open in general about talking about their own mental health, their own feelings, their own experiences, because otherwise we end up basically bottling it up and acting out of desperation at the end instead of getting help as we...
Another thing about this, it's possible to have a fulfilling life. But I think the funding that we ultimately need has to go for the long term.
Yeah.
Because as you know, the meds are not perfect yet. And hopefully with all the research that's being done, which also has to be funded because that will end up saving money, we need to have facilities where people can go to somebody who understands their history and can adjust their meds if it's needed until they find the right balance between medication and talk, because whatever it is that helps. And I thought that I had ADD. I come from a family that I've learned has a lot of depression, some serious depression, and so I just couldn't kind of get going. And work was easy, it's how to go through the day that was harder. So I went to a testing, and they came out and said, "You're depressed." And I said, "Really? I don't feel depressed." And then I realized that I'd gotten so used to kind of functioning under this kind of cloud.
Right.
That
you're hiding it in routine.
Yeah, but it came so, and I thought, wow, you mean maybe I don't need that? Like when you the best thing is the top of your toothpaste tube falls on the ground, and you have to say, pick it up, screw it on. It's like, so that was kind of it was a surprise, but I did it because it made sense in my family.
Right.
And I don't have serious depression. I have whatever it is, that low grade, and I take some antidepressant for it, and I think it actually has helped a lot. But that was a surprise to me.
And there are many different ways, and there are really many different ways to approach it, and medication is certainly one of them, but a lot of times, cognitive behavioral therapy, there are many routes that don't even involve medication that can often help people function better in their lives, and I think that's sort of an important point. Vernette writes, what can be done for advocates that want to be involved with helping? In other words, how can other people get involved? And I guess I'll ask Glenn and Senator Stabenow in particular, and then feel free to jump in. How can people get involved when they want to help?
Well, let me just say, we have some great organizations. We have the Michigan chapter of the National Association for Mental Illness, great advocates. We have a number of different advocacy groups, and I would just suggest go online and first of all look at the Michigan groups. Reach out to community mental health, like Lori did. We have some great advocates at community mental health. Contact my office. I mean, we are getting ready to rev up on the next push. We are in order to be able to get to this next step. We've started really a movement to transform the way we look at mental illness and addiction services, but we are not done yet. And so would love your help. Do what Sam did and give us a call or email us. We'd love to get you involved, both legislatively as well as, frankly, at the state level. I mean, we have a big challenge right now. I worry at the state level about some of the things that have been talked about, and we've seen funding cuts at the state level that have really hurt. And so, and I think, I will say as an elected official, that it's very important that you ask the question. If you are meeting a state rep or state senator or U.S. House, U.S. Senator or mayor or governor, this is the season of candidates, ask them what they're going to do to support mental health services. Because by just asking, you're saying, this is important to me, and I want you to be aware of it, and I want you to do something about it. So forums that come up, places where you are, writing letters, emails. If we don't keep asking about it, part of the talking is also asking public policymakers that can make decisions on funding what they're doing, and are they making it a priority?
Yeah. Well, and
if you don't mind me saying, one of the biggest things that can be done is start the conversation. If you want to help, talk to your family. Learn the vocabulary. Learn that I am depressed, I am having issues, are not evil sayings. It's not bad. You are not different. You are not lesser. Make it okay and natural. Make it as common as I take Vicodin for my back pain to say I take an antidepressant for my depression. Make it as common to say, yeah, I go home after a long, stressful day of work and I drink beers. Make it, I have this therapy I go to. I go to therapy about my depression, my suicidal thoughts. Right. Make it a daily conversation. And if you have kids, if you have teenagers, if you have teenagers and they have friends and their parents may not be as in the picture as you are, and you know your children are close with them, talk to your children's friends. Start the conversation. Change the narrative around mental health. Right. That is the first step you can take.
Well, and Lori, how would you approach helping get people involved? I mean, you yourself got involved after, you know, your circumstance.
Right. I was looking for a job, and I was told about this forum that was coming up about peer support specialists. And I thought, wow, that sounds interesting. So I went to this forum and realized that I could work with other people. And that sold me on it. And I just followed through on that path and became a peer support specialist.
I also think there are organizations, NAMI is a wonderful organization.
Mm-hmm.
Really helped my sister when Kaylin was coming back from the hospital for the first time. So NAMI is a terrific organization. Also on college campuses, the JED Foundation, started by a family who lost JED to suicide. Very effective, and then bring change to mind for high schools. Also, you'll learn that that one of the key times for a kid is when they go to when they're a freshman in college.
Right.
A lot of depression, a lot of anxiety.
Sure.
They can even, suicidal ideation. Yeah. And if you as a family know that to be aware of that. And then if you're a kid on campus who wants to help, know where those places are on campus where kids can go. I was so impressed to hear that at the University of Michigan, the freshmen each one are taken by one of their peers to the office or the place where they can get help for, behavioral health. So they see the place, they see that they'd be welcome, and they know where it is.
Yeah.
And I think that's tremendously important, especially if they can make those rooms as kind of wonderfully welcoming as possible.
Right.
Well, I'm sorry, one more thing. When you had said forums, it made me think of there are Facebook groups.
Sure.
And there are Craigslist forums. Craigslist doesn't have the best rap right now, but there are anonymous places you can go, and it's just taking that first step. It's starting the conversation.
Social media is a double-edged sword in some ways, but there are opportunities there to begin to get involved with legitimate organizations and really get help. I'm not sure I would get all my advice from
I was
Facebook.
just going to mentioning that made me think of a veterans group that's been working connected socially through their phones, folks that are struggling with PTSD that literally can just dial in and talk to somebody and FaceTime someone. Yep. And so there's a lot of ways that social media is now coming into play that is a part of it. I wanted to just stress one thing too, that while none of this stuff is easy, folks that are watching and listening, it's one thing if you can identify I'm feeling depressed, but like Glenn was saying, she thought it was something else. And so it may just be, I don't know what's going on.
Right.
Something just doesn't feel right. I just can't get it together. I don't know what it is. So, with my dad, part of his illness was that he never thought he had an illness. Never.
You cope. You learn how to cope.
Yeah, and so so it was hard at the beginning to convince him to take lithium, which actually transformed his life, but because he didn't think he needed it, because he would start feeling better, and then he would say, well, I feel better, and so then he would stop taking the medicine. And so, this stuff isn't easy. None of this stuff is easy.
No.
But it's really important. And the more comfortable we feel talking about it with ourselves, with our friends, with others, the more you find out there's a lot of hopefulness here. There's a tremendous amount of hope
I find
in
it
all of this.
fascinating.
Well,
I mean, our brains are incredible.
They're incredible in two ways, though, because we're able to justify so many aberrant behaviors in ourselves sometimes that it takes that outside look. It takes somebody, to say, this is not normal. This is something where somebody might need help. And I think, one of the things that I see in the emergency department in particular, when we have, I guess what I would say, first-time individuals, people who didn't realize things had gone completely off the rails, the degree to which it can go before somebody actually finds themselves in the emergency department, hopefully you can identify and get help before it begins to affect your personal life, your work, your daily function, relationships, because it'll erode those parts of your life to the point that you almost become alienated. And when it gets to that point and you end up in the emergency department, recovery from that is so much harder than if you had begun the simple conversation much earlier on and really started to put your life back on course. And I think that's part of removing the stigma, opening the dialogue, opening the discussion. There are resources, as an aside, locally. The Detroit Wayne Mental Health Authority has resources within the city and within Wayne County where you can get help. There are certainly resources available in Macomb County, Washtenaw County, all around Michigan. There are resources. The thing is, they are generally underfunded in many ways.
But it's worth reaching out to ask because we do have some resources.
Absolutely. Yeah. Well, we've been going for about an hour here. I actually want to kind of close things up with just a couple of final questions, in the sense that, was there anything else that we didn't talk about that anybody on the panel wants to bring up? And no is okay, because we've covered a lot of different topics.
I would just close by saying that I think we're at a very important moment in time on this issue. First of all, traditionally, the brain has been the least researched organ in our body. And under the Obama administration, they started something called the Brain Initiative, which is now researching, and we're finding all kinds of amazing things, as Glenn was saying, that affect not just mental illness, but Alzheimer's and Parkinson's and MS and everything that relates to the brain. And we have these wonderful renewed efforts that are focusing on stigma, and we are focusing on treatment. I mean, this is the hopeful time. This is the time when we can actually bring this to a whole nother level and really make this a part of just the discussion about comprehensive health care.
Yeah.
And about how we support each other and so on. So this is a time, I would say, not to retreat, but to engage at whatever level that you feel that you want to, because we can together make a real difference on this.
Yeah. Make yourself heard, really, however you can.
Yes.
I'd like one more time just to reiterate, it starts with the conversation. It starts with talking. It starts with talking to family, friends, trusted adults if you're a member of our youth community, teachers, staff at school, coaches. I feel some of the greatest confidence talking to some of ex-coaches now, coworkers that I work with through the public school system. I have some of my greatest confidence to go to them. And I wish everyone could feel that same way. I just want to get the point across. Starting the conversation. And I know I'm saying it's as simple as that. And for some people, it can be a really hard step to take. But once you take that step,
it's just a barrier that has to be broken.
It's the first wall down. Life gets easier.
Yeah. Lori?
I just want to say it's really important to have a support system.
Yeah.
And have someone to reach out to, and someone that can help you and see that things are right, because a lot of times when you're in the depths of mental illness, you think you're hiding it from everybody, but eventually it comes out.
Right.
So it's important for someone to be there.
And I just want to echo one other thing that Senator Stabenow brought up earlier. It is much less expensive to treat mental health issues as they come up along the way, outpatient, than it is when it reaches a crisis. No question about it. Mental health issues destroy families, destroy lives, destroy the community in ways that you cannot imagine. And also keep in mind always, there is a mental physical health. And the better you can preserve your mental health, the more likely you are to also have good physical health. I just want to thank everyone here, Senator Stabenow, Glenn Close, Sam, thank you, and Lori. Yeah. Thank you so much for coming. Thank you so much for sharing all of your ideas and all of the information. Hopefully this has been of some use to you. Feel free to send in questions on Facebook even after you watch this, after the fact. Hopefully somebody will be able to get back to you. And with that, I'd really like to say thank you again for tuning in, and have a good afternoon.